growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, Dr. Steve Rasner here. Welcome back to The Lionhearted. Right off the bat, you can reach me at my email, Dr. Rasner, no period, D-R-R-A-S-N-E-R at AOL.com. And you can find out my courses and my in-office surgery courses at RasnerInstitute.com. Last week, I was being very specific about the importance of the moment the patient hears about you, what they've heard about you, where they read about you, when they're going to make that first call, right on through its relevance to when you recommend treatment and they say yes or no. It's pretty important stuff. And I was talking about how you brand is important. If you brand that you're the emergency doctor, well, what do you think you're going to get? If you brand that you're the Kmart of dentistry relative to inexpensive fees, affordable dentures is that brand. I just don't understand, of course, in one opinion, why you'd even want to be that brand. I mean, it's hard enough to do what we're doing and make it all rewarding, make it all work, even when you do it at a reasonable reimbursement fee. So to me, and I know those of you that are tuning into me now for weeks or months, know that my model is how to, maximize your experience in dentistry, from feeling fairly compensated to not seeing dozens of patients each day, to providing the best clinical care possible. And I really mean that. It's not just, I think it's easy to say the best clinical care possible. I really mean a dedication in your career to a lifetime of CE, so you can absolutely separate your skill set from the pack. But let's forget all that for a minute and go back to this moment. And I was talking about, then they have to call your office, right? At some point, they've listened to your branding, and now they're going to telephone your office. And that is the first of several moments of truth that lead to either, I'll think about it, them leaving abruptly, not getting you at all, or saying yes. And I got to tell you something. Week after week, practicing in a community that's pretty challenging, where I practice in southern New Jersey. I'm sure all communities have challenges. I'm sure if I'm in a big city, the challenges might be that there's 20 other dentists in the building I'm in. That's a challenge for sure. But having a challenge of patients, usually, if not always, having less available disposable income than they actually need for my recommended care is certainly a big thing for us to get by. And let's take it a step further. Here's what's really hard. Here's why I put so much focus on these subjects in this podcast. Because think about the whole picture. In other words, think about the picture, the climate in dentistry that these patients likely went to and experienced before calling your office, if your office follows a model anything like mine at all. The majority of the profession is insurance driven. It's not my imagination. So when you have an insurance driven practice, I don't know how important all these little things I'm talking about are. When you take insurances that pay you a considerable discount of your regular fee and you accept that, and they could go to you or 20 other dentists that accept that reduced fee. I don't know how important all these things I'm telling you are. I wouldn't think they are as nearly relevant to the blueprint I'm trying to provide for you. But in my model, I'm very cognizant that this patient that's calling us is going to experience something they haven't experienced before. That would be attention to detail that I have mandated in everything from that person that takes that call to the first person they see as they walk through our front door, to the person that walks them back into the operatory, to the surroundings, from the colors I chose, to the lighting, to the state-of-the-art dental equipment we have to provide the services. And then my approach that I've hammered so many times on these podcasts about a comprehensive approach to the patient who didn't call you desiring a comprehensive approach. And the reason you're doing it is not to get in their pocketbook, of course. The reason you're doing it is because it is the appropriate approach to a patient to provide them the best care. Even if that results in a patient that may have come in and would have treated a root canal on one tooth, but you did a comprehensive approach and they have found out multiple other needs that they have that they weren't aware of, and now may bypass that tooth that they came in with and maybe even have it extracted because in their particular scenario or budget, it doesn't fit now that they know the whole picture. I mean, does that resonate to you? To me, it's crystal clear. And I have to tell you, not everybody gets it. I mean, I think most people do. When I say most, I mean 90+%. That I have somebody in my chair, I give the approach that I've laid out for you in these podcasts of case presentation over this year. And most of them seem to get it. And it doesn't, it seems rather, I guess I wait sometimes for somebody to say, why are you doing all this? I just want my tooth pulled. And quite honestly, it goes back to that first phone call. That's why that doesn't happen to me. And I'll explain in just a moment. So yeah, you better believe that I need whatever they're experiencing. And I don't mean, I hope this is coming across clearly. I don't mean that they walk in and they see waterfalls in my reception room, or, we sing a jingle when they open up the front door, or it's so opulent in my office that it's mind-blowing to them. I don't mean that at all. I mean personal valued experience that's different to them, experience from the first phone call to the moment they walk in. And so I'm going to go back to the person that's taking that call. And the reason that's so important is I'm going to get information from my new patient coordinator that needs to be way beyond an upper right tooth hurts on this new patient coming in on Tuesday at 2:00. I want a backstory if I can get it. They're a school teacher and, time's a consideration, or they have 4 kids and money is a very big consideration, or a recent divorce, or whatever the scenario is. I want as much information to help me, because it will help me with this patient that I suspect hasn't had the experience that we're going to provide for them. And if it doesn't mean anything other than doing a complete exam, then that's in itself is good enough for me to know about this patient. And I do get a Cliff Notes version of who's coming in, and so that I've referred in earlier podcasts to this thing we call the screen. And it kind of goes like this. Michelle says at one time, so she gets the basic information, Michelle was doing this just whether it's 4 new patients in a week or 12. Every single one is getting a person on the other end of the line, which is Michelle, who feels like they're smiling to that patient, who's upbeat, who's proud, welcoming them into our practice. I've seen it for 39 years. And I would hope you would have somebody that's either on their way to being that or is very much like that. And I've found in my 21 years of lecturing that most people have some degree of a Michelle. And that person can bond with the person on the phone. They love people. They don't carry baggage. It's really important stuff. And then she does this screen. And the screen just means that we're finding out as much information as we can over the phone, of course, without violating HIPAA laws and things like that. But, it's like they called usually with a specific problem. I have an upper right tooth that's broken. I have a lower left that's causing me pain. Michelle will go on and ask them, well, can I ask you a few more questions about your mouth? And those questions can be what's relevant to your practice. We'll ask, are you missing any teeth that you're aware of? How do you feel your gum health is? When was the last time you went to the dentist? I don't know how far she takes it, but it's not in a rat-a-tat-tat form like I just did for you. It's in a conversational form that helps the patient. And Michelle makes it clear that this helps us get to know you ahead of time and provide a better experience. And then guess what? She makes the appointment. They come in. I've already told you numerous times that if they indicate at all what sounds like significant need, and that would be indicated by, wow, I haven't been to a dentist in 5 years. You're going to be scared of my mouth. And, I think you all know what I'm talking about. We will highly try to influence them to bring a significant other. Okay? And then they get to the office, and that is an important moment for us also. And remember, I'm discussing parameters of case acceptance that actually occur outside the treatment operatory room. And in this case, when they walk into our office, naturally, you hear me use the expression Walt Disney clean all the time. And, they come in and use your restroom, and for whatever reason, the prior patient didn't leave it well. That just can't happen. So and I always make this comment, your team will only know what's important to you if you let them know what's important to you. And even after doing this for almost 4 decades, Monday mornings, I'll remind my staff just randomly sometimes, hey, let's make sure we're spick and span everywhere today. I'm not even going to talk about the operatories because, I have somebody employed. I have 2 people employed in my particular practice that just pay detailed attention to everything from a sterilization area that looks very clean, where the instruments are done, to, of course, the operatories. They are expected to do a double inspection of a room before anybody comes back, just like in hotel rooms in high-end hotels. I know sometimes it's, oh my God, this is so overwhelming. How am I going to get all that? It's not. It just happens through time by you letting the team know what's important to you. And you have to have team members that understand why that's important. So that would include going back to that initial moment they walk in your reception room. I guess your reception room has to look outstanding all the time. I think somebody has to be in charge of looking out there. Even the glass, in my particular case, there's a door between my reception room and the rest of the office. I mean, I do find myself once a day walking past somebody saying, we need Windex on the front door. And I don't want to come off maniacal and but I notice everything because I think everything counts. And of course, I want them to be greeted by somebody that stands up and either walks in the reception room or walks to the open window we have. There's no glass at that window. So we have a door, and then there's a separate area that's wide open. I absolutely make it clear with my team that I want them on a new patient to come out, greet them, hand them the chart if it hasn't been filled out already, welcome them to the office. And it happens. It's like a symphony when I see it happen. It's a beautiful thing, and it happens all the time. I don't always witness it, but it's a great thing. And then time. Time. There was a period in my practice where we were chronically late, even on new patients. And there's just no excuse for that. That's all a matter of you prioritizing what's important in your practice to you. And it's an easy way to separate yourself from the masses. I mean, think of yourself for a minute. The last time you went to a business and they kept you waiting, any type of business. I mean, we're all good with 5-10 minutes, I think. You get to 15 minutes, it starts to be a problem for me. It totally changes no matter what I thought or heard of the business I'm going to at that point. Think of the opposite. Think that in our office, they usually don't have time to fill out the chart if they haven't done prior, so they're taking it back to the operatory and filling it out there. So being on their time is a tremendous way, a palpable way to feel different. So look, all I've talked about so far is you're branding out there. They can trust you, that they should have confidence in you. In my case, that we are the sedation practice. And then they have received this phone call. You can't drop the ball there. That's probably the most critical element of the whole thing right then. Then they come in. And what I just described has to happen. And that would include walking back to the operatories, and we've covered that in great detail up to now. But do you understand, I know I said it today, why I put so much emphasis on this? Because even when I do that, I had somebody this week, I'm going to tell you the story, a real short story. She was a new patient to us. She certainly looked dressed better than a lot of my patients. And she was in the banking business. She was a banker. And by the way, she was a referral from another patient who had invested considerably in our office. So that, it doesn't get any better than that for me. And I really expected a lot more. And she went through these channels that you're hearing me talk about. And I could tell immediately when I was in there doing what I do when I walk into the operatory, and I've told you about this in past podcasts, walking in, very colloquial, like, hey, how did you find out about us? It just seemed like we weren't connecting. I don't know what it was. Something was off. And I did what I tell you to do. I did a comprehensive treatment plan. She came in for sensitivity on number 9, which had an abfraction and an old restoration that was leaking, sensitivity to sweets. But I did a complete exam, and I found, I didn't want to find it. It is what it is. I found 2 crowns with root canal with recurrent decay. And I mean recurrent, not leathery decay, not just a little spot. I mean clearly failing crowns that were asymptomatic to her. And then there was a third tooth that had been restored with a prior amalgam that had clearly recurrent decay. She didn't come in for any of those things. And we presented like we do everybody else. I went through all the channels I've discussed with you. And oddly, she almost was offended. And I got to tell you, I tell you guys everything. I tell you the way it is. I think it's important that I share moments like that with you, because that rarely happens to me. Do they sometimes come in and often can't afford the treatment I recommend? And if you haven't seen earlier podcasts, I've made it very, very clear. I try to go into these with the mindset of being as conservative as I can possibly be, as long as that won't hurt the patient. So what I mean by that is, yeah, you can be conservative and do another core buildup on a tooth that's 70% restored already. I don't know if that's a great idea, if it's a molar. You certainly don't have to replace every missing tooth you see, and sometimes you don't have to replace any of them in the beginning of your relationship with them. That's what I mean by being conservative, and I absolutely have learned that that's the best way for me to attain trust in patients. And in some patients, It works beautifully, and down the road, 10, 15 years, their whole mouth ends up being restored, or most of it. In other cases, we never get to restore them, and they live with a somewhat dysfunctional dentition, missing a tooth here or there, maybe some old restorations that never get completed. But, that's an important point if you haven't heard me talk about it before. One of the most embracing things that are happening in the operatory with me, by embracing, I mean, I actually think that when I'm going through the case presentation with a patient, and by the way, a lot of times it's happening at the very first visit. So you may not be able to do that if you've only been in dentistry for a couple years, but I can tell you what you can operate that way when you can make recommendations. Majority of your patients will like that. Don't do that if you can't figure it out. Absolutely have a second visit to go over your recommendations, but when you can, a lot of patients like that. So my goal is certainly to be conservative whenever I can. But by the same token, you have to draw your line in the sand as to where you won't treat them if they won't do certain types of treatment. So a good example would be the health of the soft tissue. Have you ever been in a situation where your treatment plan was for quadrant scaling, root planing, and somebody, your treatment coordinator came back to you after you told her what you wanted to do with the patient, and they said, does it have to be quad scales? Can it just be a regular cleaning? And it's almost offensive. It almost suggests that you made that up to inflate the treatment plan. I mean, I don't know how anybody would ever do that. So one of my lines in the sand is soft tissue optimal health for the teeth they have remaining. That would by far take precedence over replacing missing posterior teeth if I didn't think that was a critical issue in this patient's treatment plan. And I tell the patients what I'm telling you. When I think it's not on every case, but when I think it's appropriate, I tell them, listen, I'm going to tell you what my philosophy is even before I look at you. I try to be as conservative as I can be with you because I know you want me to be. It means less time in the chair. It means less money. But I'm not going to recommend things for the sake of you liking me or you feeling good about me and become what I call a good old Dr. Joe. So my line in the sand is optimum soft tissue health. And then secondly, I'm not going to be okay, and this has happened to me too, I'm not going to be okay with leaving periapical pathology and not either recommending a root canal or extraction just because they didn't feel it and they weren't aware of it. If you haven't heard me say this before, it's an optimum time for me to say it. I will say to many, many patients before I'm doing all this the following. I will say, look, the mouth is unlike any other part of your body. If you had a rash on your arm, you woke up with a rash on your face, on your arm, you don't need anybody to tell you that you need to do something. If you had a slight fever, you don't need anybody to tell you you have a fever. But the profession that I chose, dentistry, is not like that. You can have abscesses, big cavities that don't hurt you yet, gum disease that's asymptomatic. That's why it becomes our responsibility. In this office, we want to protect you. We want to keep your future needs to a minimum. And that stuff just rolls off my mouth, because it's true. That is what I believe. So, again, I tend to get off the track. I'm sorry for that. But I'm trying to create for you, I don't think I could say it enough, the importance of everything leading up to me talking about these things. And even when I do it, sometimes it doesn't work, and that's okay. The last thing I want to do is have somebody walk out or accept treatment on a plan that I compromise below my standard of care to get them to say yes. Doing a 2 implant case with locators on an atrophic mandible, for me, would be unacceptable. Think about that for a minute. Let's say you're having a really bad week of a bad month. And somebody comes in during at the end of that week and they don't have the, let's make up a number, they don't have the 16,000 or 18,000 you normally would require to place 4 implants and a bar and an overdenture. They have 9,000. I'm just making the numbers up, of course, but they have 9,000. Then it becomes an ethical dilemma on your part on what that line in the sand is for you on that particular treatment plan. I would tell you 9's fine. You're just going to have to do your treatment plan the way you're supposed to do your treatment plan and not provide 2 implants with 2 locators on a mandible. Or certainly, somebody came in this week to me. They had 2 locators on a maxilla. And guess what? It had lasted 12 years. One was finally failing. That's why she was coming in to see me. So you see weird things out there, right? So listen, I know this is a subject that I'm very passionate about. And I'm passionate about it because this road that you and I are on, that I'm trying to get you to emulate, is a road that you can be proud of the care you provide. It's a road where you're going to get turned down a lot. It's a road where I want you to understand that it requires a lot of detail to intention. Even all these things I'm talking about in the last 2 podcasts with regards to how your waiting room looks and your restrooms look and what kind of, how that first phone call, because it does matter if you want long-term success. And it's exactly what I've done during my career that's enabled me to have these things you hear me allude to, like 29 consecutive years once. I had 29 consecutive years of increased growth and profitability. Think about that. If it happened to you starting in 2019, you would go to 2049, I believe that's the math, and know that every year gets a little better and better. Then I had 3 down years. It was a recession in 2009, 10, and 11. And then we made a comeback. So listen, be sure, not that many of you write to me. Some of you do. If you want me to go over certain things in these podcasts, I sure as heck would love to hear from you. It's hard to do these each week and come up with things that I know all of you hear. But I hope you appreciate them. I hope you're telling your friends to keep tuning in. And thanks for checking me out this week on The Lionhearted.
Hey, it's Beth at the Rasner Institute, and I'm here to tell you about one of the most empowering courses in dentistry today. We offer a highly personalized, hands-on, live patient course here in our office in New Jersey. We're going to ask you what types of procedures you're hoping to see, and then we'll line those procedures up with the available caseload. You'll work in a team with another doctor, taking turns as doctor and assistant, and when you need help, we're there to guide you. But now we've got some new options. Now we're offering a limited number of observer-only spots. Maybe you're just not ready to make that hands-on move into live patient. Maybe watching will help you get ready to make that move into live patients. So come and join us as an observer. The second option is a single-day option. We've heard from a lot of people that maybe 2 days was too much and they couldn't get away. So now we're offering Friday only, Saturday only, or you can still come for both. And no matter which day you come, everybody's welcome to come to the Friday night dinner. It's a totally awesome and empowering experience that will leave you feeling like a gladiator.